Khan. I am Dr. Tanseer Asghar. I am a general laparoscopic surgeon working in Pakistan. Today I will be talking a bit about hernia surgery and the fixation devices and the prostheses which are being used. First of all, it is important to understand that what types of mesh are available in the market. Okay, so one is the macroporous meshes having pore size more than 75 microns. The other ones are microporous meshes which have smaller pore size. There is a combination of the macroporous mesh along with some elements of microporous mesh, and there are some biomaterials like synthetic meshes, biological meshes, composite meshes, polyester meshes. So this is a brief account of the types of meshes which are available in the market for hernia surgery. These are the most common meshes that are available, but there are some other types of meshes as well. Okay, what is pore size? The importance. The pore size, if it is more than 75 micron, it will allow more infiltration by macrophages, fibroblasts, blood vessels, and collagen. So it will enhance the recovery phase of the patient. Mesh which the large pore meshes will allow more soft tissue growth and more flexible because of the formation, avoidance of the granuloma formation. Granulomas usually are formed and they form along the mesh fibers and as part of the foreign body reaction. This leads to stiff scar plate and reduced flexibility. It occurs in mesh usually less than 800 microns. So the macroporous lightweight meshes are superior than the microporous regular meshes, which are heavy meshes available in the market. So what are the properties of an ideal mesh? First of all, it should be, easy to use in the OR. Secondly, it should invoke a favorable host response. Then it should behave well when there are infections. It should behave good, and it should resist the shrinkage and defecation properties of the mesh. And of course, it should be a bit less expensive. So when we apply meshes, what is the common problem we encounter? They are seromas, they are infections, and another important factor which we usually miss and we just always counsel the patient, that is pain, which is one of the leading factors which usually patients complain. It is also called inguinal in case of inguinal hernias. So what we do and why it happens is that if there is shrinkage of the mesh, and there is usually shrinkage of the mesh in about most of the meshes which are heavyweight meshes and which are microporous meshes, and usually it is less in the macroporous meshes and in the few synthetic meshes and the biological meshes which are available in the market. So we have to usually go for some kind of injections afterwards, like steroids at the place of the nerve pain, or we have to go for surgery sometimes to remove the scarred, nerve or scarred area and along with the mesh. There is another important factor which a mesh should possess, and that is the tensile strength. Usually the tensile strength of the abdomen can be calculated by the law of Laplace. The elasticity of the abdominal wall usually we see is 38%. And the lightweight meshes possesses near to that is about 35%, and the heavyweight meshes, they possess 16% only, which are usually polypropylene heavy-based microporous meshes. Okay. The shrinkage occurs, the contribution to about 60% of the scar tissue gets shrink in cases of the heavyweight mesh. And if we compare a mesh which is just a polypropylene heavyweight mesh, it usually shrink up to 60 to 94%, and the macroporous meshes, they usually shrink like 5 to 10%. So they are far better. Today I will demonstrate you a few mesh which are available with us, and if you can see, this is a macroporous monofilament paraffin mesh. It has got I open it for you. You can see that it has got here big pores, right? This is macroporous polypropylene mesh. There are different sizes of mesh. It can be 6 by 11, 15 by 15, 10 by 20, and 30 by 30. And some companies make different mesh sizes as well. Here you can see a 6 by 11 macroporous mesh. Now, here you can see a polyester mesh, which is monofilament mesh. Here you can see it. It is also macroporous. Are you able to see it, please? Okay. Now we have this and other 6 by 11 monofilament vertex macroporous polyester mesh, different size. And here you can see a lightweight mesh. This is also 6 by 11. If you compare this macroporous regular mesh with, if I can open it for you, it has got same macroporous size, but the weight is very less. So weight also depends on the size of the mesh as well. So if we can compare these two meshes, this is a better mesh. It has macroporous and small size. This is also a good mesh, which is a macroporous mesh, but it is not lightweight. So here you can see a 30 by 30 macroporous lightweight mesh. And here you can see a regular Prolene mesh, which is heavyweight, and we use it every day. Most of the people use this mesh. This is another mesh, which is 30 by 30 mesh. And this is also a polyester macroporous mesh. So these are the meshes which are usually used in the inguinal hernia open repairs and in repairs which are done laparoscopically like PEP and TAP. You please place these meshes. Usually in inguinal hernia, 10 by 15 size mesh or 10 by 20 size mesh are usually used in the laparoscopic procedures. And in the open procedures, 6 by 11 mesh is used. So we have another mesh over here. This is a very nice mesh, which is a pro grip mesh. This is a self-fixating mesh, which is used laparoscopically in inguinal hernias. And the quality of this, the size of this mesh is 15 into 10 centimeter. And the quality is that if you can see over here, it has got a green border, which shows that whether it is to be kept on the right side of, it is used on the right side of the inguinal hernia or in the repair of the left inguinal hernia, this side will be towards the medial side. It has got grips in it, which can be easily placed, and you need no tacker to fix it. Now, I will give you also a brief account of the meshes. Here you can see a composite mesh. This mesh is usually used in the open surgeries as well as in the laparoscopic surgeries, usually in the ventral hernia repair. So this is a size of 20 by 15 centimeters, but we have also sizes of 15 by 20 centimeters and 25 by 30 centimeters. I will open one mesh for you. I will open this for you. This is a 20 by 15 mesh. And here you can see the sizes which is given 15 centimeter and 20 centimeter. The other size panoramic, it is 20 by 25 centimeter and 20 by 30 centimeter. These are the different sizes and the different shapes this mesh can possess. This here you can see the mesh. It has one layer which is a hydrophilic layer, and the other layer is a layer of, you can see that this is a hydrophilic layer, biosynthetic layer. It's a composite mesh, and this is the layer which is a layer for polypropylene. So this layer will go upwards towards the interior abdominal wall, and the downward layer, which is a hydrophilic layer, is a gut-friendly layer. So it doesn't affect the small intestine or the contents of the abdomen. So this is one type of mesh. The composite mesh also has different type of, here you can see another type of composite mesh, which has got two threads which are proline, which are already there. There is also a center point and a few points for tacker. This is also a size of 20 by 15 centimeter composite peritine DS mesh. We roll this mesh inside the abdomen through the trocar, usually 12 mm trocar. Like we roll it like this, and we hold it with one of our forceps, and we put it in. You will be able to see this when we will be having a ventral hernia class online live surgery, and we open it inside the abdomen, and with these two threads and using a needle, this is called endoclose. Using this endoclose needle, you can see here it has got cobbler type needle, and it holds the proline and pulls it out from the abdominal wall. So we use this endoclose for using it. Then after placing these two on the hernia site, after reduction of the hernial contents, we use a tacker to tack it. There are different types of tackers which are used. Some are absorbable tackers, and some are tackers which are metallic tackers. Metallic tackers are usually used in inguinal hernia surgery, but most of the surgeons now use absorbable tackers even in the inguinal hernia surgery. And the absorbable tackers are used more nowadays than the metallic tackers. This is one of the absorbable tacker, which is 5 mm in diameter and about 37 mm in length, centimeters in length, and it has got 30 tackers inside, which are absorbable tackers. I will open one for you. So you can see the shaft of this tacker, right? It is 5 mm in diameter, and here is the firing place. It has got 30 tackers inside, and they are all absorbable tackers, and they are usually purple in color, or violet, you can say. So whenever you find a mesh and you want to tack it, you just put it like this and fire it. And here you can show, here you can see the violet colored tacker. I will do another one. Here you can see another tacker there. These tackers are absorbable afterwards. So this is a very good tacker and has been used for a very long time. But the issue is that it is difficult to use this tacker on the interior abdominal wall when you are coming towards yourself. For example, you are taking a device thing which is away from you. It is easy to tack over here, but coming towards yourself, you should have an angle of 60, 70, or 80 degrees in the abdominal wall to tack it. So it has got no angle. For this, now a new tacker has been introduced, which is called Hernia tack. It is an articulating reloadable fixation device. The superiority of this tacker is that it has got an angulated firing spot where you can, articulate it up to 65 degrees. And how you will do it, I'll show you in a while. And it has got another very good property that these reloads are available in the package of 10 tackers and 5 tackers. So it also reduces the cost of incurred over the patient. Here you can see the Hernia tack. So this is the reloadable shaft which you can see, and here you can see that it has got a 65 degrees angulation. Here I will articulate, just show you. Here you can see that it can be articulated up to 65 degrees. So it will be easy if we just imagine that this is in the interior abdominal wall. You will be able to see it in our masterclass live soon when it will go on ventral hernias. Here you can see moving, tacking, 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 and tacking. This has got a very good angulation of 65 degrees. And how to load and unload it, I will show you. Whenever you want to unload it, there is a button over here over which it is written load and unload. Press the unload end and you can pull it out like this. And when you want to load it, you just push it like this and it will load it. And how to fire it? There is a push to fire button which is red in color. You just push it like this and then you will go and you will just take it like this. Here you can see it has done the tacking here, and we can also angulate it like this. Okay, coming on to the old conventional tacker, which is called ProTack. It has been used for many years, probably more than 1.5 decades. And you can see that it is also a tacking device with metallic tackers, titanium tackers in it. It is a fixation device. It is called ProTack. And I will show you. As you can see, this is the ProTack. It is also a 5 millimeter. I have got a 5 millimeter shaft, 37 centimeter long, and a straight non-articulating shaft. What we do is we put this tacker like this and apply tackers. These are metallic tackers which we use in this. Now there is another device we have over here. This is called a glue or a liquid band fixation device. Here you can see this device. So in order to use it, here you can see that it has got a glue over here. And we press this button and we use this end, and instead of tacker, we use this glue to fix the mesh, either the inguinal hernia mesh or a ventral hernia mesh to the abdominal wall or in the inguinal canal, like this. The superiority of this mesh is, glue is that it helps not to, damage the area of pain, and you can apply easily over there as well in inguinal hernias. And same is the procedure with the meshes, which is called the ProGrip mesh, that it can be applied even on the iliopubic tract as well, because there are areas of pain and areas of disaster over there, and it can be easily put over there without using a tacker. So this is a brief account of some of the devices we use commonly in our setups, and they're easily available in the market. There are some more meshes like the biological meshes, having collagen services and use of porcine or bovine materials, and they are also available in the market, and they are used quite common. So this was a brief account of the hernia devices and the fixation and the prosthesis we usually use. If there is any question, you are always welcome.
Great. Thanks very much, Tanseer. You've described it very nicely and helped us to understand. Tanseer, just one question. There's one question from the audience, which I think has come up from Namra, about the sizes of meshes for laparoscopic or open inguinal hernia repair. What I'll do is I'll probably hold that question for both for tap and tap when they explain that, to pick it up at that time. But just a question from you. For the tacker, if you have got now absorber tack available, what is the place for non-absorber tackers?
Sir, basically, it is better to use absorbable tackers now, because in inguinal hernia surgery, a few surgeons rather many surgeons don't use even tackers and they just place the mesh. But there are studies and documented facts that the tackers, if not used even in the initial part, the mesh can migrate into scrotum, and there are many cases reported, and it is also available in the text now as well. So I would suggest that using an absorbable tacker is better than using a metallic or a titanium tacker. But we have to consider a few things. That if we have to see the prices, the absorbable tackers are 3 to 4 times expensive than the tackers which are used metallic tackers. So metallic tackers are not obsolete, and we all know nothing is absolute and nothing is obsolete in surgery. So there are different indications, and using less expensive thing for people is also one of the indications, especially in our parts of the world. But those who can afford using the absorbable tacker is better. And if we compare these two absorbable tackers, one is Absorbatak and the other is Reliatak. Reliatak is better because it has got angulation. No doubt it is expensive initially, but it has got the reloadable cartridges in it. So the cost comes very less for the patient when it's being used repeatedly.
Great. Thank you. I think anyone from who's got another, I haven't got any more questions. I was going to invite, move on, but yes, sorry, Burkhan, you got a question?
Yes, thank you very much, Doctor, for this presentation. I need to ask what the material is the tacker is made it, and it is absorbable and non-absorbable type, and what affects the pain? Is it to use absorbable or non-absorbable?
Okay, this tacker is made up of a synthetic material like Vicryl, and it is absorbable within 90 to 120 days. And it is better to use an absorbable tacker because the strength will be given by the mesh when it is, when the fibrosis occur and the collagen and the blood vessels all migrate in the pores of the mesh. There is no use of tacking device later on. So if we use metallic tackers, I don't discourage using metallic tackers, but if they are being used, they should be used in the inguinal hernia surgery. They should not be used in the surgery for ventral hernias. The reason being that the metallic tackers might cause some adherence with the intra-abdominal, or they erode the intra-abdominal organs, as they will stay there forever. The titanium, it will never get absorbed.
Great. Thank you. Thank you very much, Tanseer. That's been a great presentation, and it sets the scene very nicely for the rest of the day, because I think it's very important for us to understand the materials we use before we start putting them into our patients. Thank you very much, Tanseer.